Here's a financial reality that might shock you. Choosing to skip vaccines doesn't just put your health at risk. It's literally draining billions from America's healthcare system right now. Donald G. McNeil Jr., who spent 25 years tracking pandemics as the New York Times global health correspondent and penned The Wisdom of Plagues, Lessons from 25 Years of Covering Pandemics, pulls no punches when discussing the true price tag of vaccine hesitancy. His assessment? The anti-vaccination movement championed by figures like Robert F. Kennedy Jr. isn't merely scientifically questionable. It's creating a financial disaster that every American will eventually pay for. But here's where it gets controversial. While we debate personal freedoms and medical choices, the cold, hard numbers tell a different story. The economic burden of preventable diseases is astronomical, and it's hitting us where it hurts most, our wallets. Think about it this way. When someone skips a routine vaccination and later requires hospitalization for a preventable disease, who do you think covers that bill? The answer might surprise you. Those emergency room visits, extended hospital stays, and complex treatments for diseases we could have prevented with a simple shot don't just disappear into thin air. They translate directly into higher insurance premiums for everyone. And this is the part most people miss. America's healthcare expenses have been climbing at an alarming rate for years, forcing insurance companies to bump up their premium costs faster than general inflation rates. Meanwhile, Medicare's trust fund, the safety net millions of Americans depend on, continues to face mounting pressure and dwindling resources. The mathematics here is brutally simple. Every preventable illness that requires medical intervention adds another layer of cost to an already strained system. When we multiply this across thousands of unvaccinated individuals, we're looking at a cascade effect that impacts not just individual families, but entire communities and healthcare networks. So here's the million-dollar question, literally. If vaccines are proven safe and effective at preventing costly diseases, why are we allowing ideology to override economic sense? And more importantly, should the rest of us bear the financial burden when others choose to forego prevention? What's your take on this? Should there be financial consequences for choosing to remain unvaccinated when safe, effective vaccines are available? Or do you believe personal medical freedom should always trump economic considerations, regardless of the broader impact on healthcare costs? The comment section is waiting for your thoughts. And don't hold back if you disagree.